especially for the points regarding feedback loops, which are often ignored and are critical to the learning process. So I'm very delighted to invite Nick Trentadue to the podium for his presentation. Nick is the Director of Laboratory and Diagnostics Informatics at Epic.
All right, thank you very much. So first and foremost, thanks for the invitation to speak about it. So hopefully my voice will come back a little bit. It was a very long hockey tournament weekend as a coach with twin 7-year-olds. So a little bit about Epic. Epic is an independent, employee-owned company in the Madison, Wisconsin area. It was founded by our still current CEO, Judy Faulkner, with an integrated database surrounded by the patient. This is actually an older picture of Judy's granddaughter. And if you look at each of the petals around her, we like to think of it as all the different specialties, all the different areas and points of healthcare in the journey that integrated data might be a part of the patient's story, such as surgery, genomics, radiology, pathology, inpatient care, outpatient care. All of that information is centered around the one patient. As Dr. Gold and others have talked about today, there is all sorts of data and inflection points in terms of where patients are getting care today. It might be in a retail clinic. It might be at the dental office. Groups are sending tests out to specialty diagnostic labs. We have groups who are providing hospitals in the home, doing social care. These are areas that many of our customers are working in, and then also interactions that many of us as patients have every day where we're getting care. And bringing together all of this data is really important, not only for diagnosticians, but also for the patient to make sure that you are getting all of the right care and have all that healthcare information at your disposal. So cancer. Everyone in this room has a friend, a colleague, perhaps yourself, who's been touched with cancer. This is an actual report from a close colleague of mine whose dad received this report a couple weeks ago. So today, this type of report is meant for a discussion and a dialogue between two long-trained professionals in the field of medicine to determine what's going on with the patient. This was sent directly from a pathologist in their office right to the patient's phone. He's looking at it, benign, benign, benign. Oh, this is good. I don't have cancer. What's going on here? But then 6 times he saw it. Then he got to the bottom. Well, it doesn't say cancer. It says something different. Do I have cancer? Let me Google that. Maybe I've been playing with ChatGPT. What does this mean for me? Confusion, doubt. These are some of the emotions that when I talked to him about this talk, he said he had. But at the end, he did feel optimistic. Today, what we're dealing with is a relic of that diagnostic report discussion between physicians to physicians. And this is going right to the patient. And this can be nerve-wracking. What typically used to be a conversation with a provider to say, hey, we got your report back. You have colon cancer. You have breast cancer. And this is what we're going to do about it. Or here are the options that we have to move forward in treatment. But this is today's reality, and making sure that we have tools to translate this and to make it very clear to patients is always going to be very important as well. So when we look at integrated diagnostics, I wanted to take a little bit of a peek into the 3 main players: the diagnosticians, providers, and then also the patient, who we just talked about. So the diagnostician. Today, many of you have talked about the systems that you use, whether it's a reference laboratory, whether it's your own in-house laboratory doing different assays or different NGS tests, whether working in the same room, perhaps like at Penn, with your radiologist to make sure that you're providing the proper diagnosis. The key to making sure that you can come to the diagnosis is having discrete, interoperable data from all systems going bi-directional. So if you're working with Sectra, if you're working with Siemens or any other vendor who's sending that information, it's extremely important to make sure that we're following those industry standards as Travis mentioned this morning, whether it's HL7 genomic specification, using FHIR resources, connecting to receive clinical information through CCDA or care quality, all of the ways that data can be standardized and brought together is extremely important for diagnosticians so that they can come to the right diagnosis. The next group is the provider. So going back to our patient, the provider would have received the pathology report, would have been able to have the conversation for the provider, but having discrete outcomes, having discrete variants, having discrete laboratory data allows the power of AI, machine learning, and other of the technology promises out there to make sure that you not only have the result from the diagnostician, but how exactly are we going to treat this patient? This is the first course of therapy. This is the second. This is the third. How do we add an element of humanism? Well, the patient's 92 years old and they don't really want to treat this. Or the patient is quite young. Do we be a little bit more aggressive? What are the outcomes if we go one way versus the other? Should we start chemotherapy, radiation, and surgery, or do something in the middle? All of those are going to be very key, and we can only do that when those models are working with that discrete data. And then finally, the patient. So making sure that the patient is kept up to date with the prognosis is key. Using patient portals that take advantage of all of that integrated data coming from all of the different disciplines that we've talked about, from the lab, from radiology, from pathology, and making it actionable from the patient. I think sending a pathology report, yes, of course, some people are going to want to know exactly what that diagnosis was, exactly the technical meanings of it so that they can use it, get a second opinion, et cetera. But at the end of the day, most of the time, as a patient, at least for me, I just want to know what's wrong. But most importantly, what are we going to do about it? And what is the recommended treatment and or therapy so that I can help to plan? It might be as simple as, hey, the next step is chemotherapy. I know I'm on this protocol, and my cycle is going to be Monday, Wednesday, and Friday. That's something that I can have access to in my portal, can go to my calendar, and then I can move forward with my life. The power of data is really what integrated diagnostics is. And making sure, first and foremost, that this information is discrete and actionable and bi-directional to everyone in the care team. Whether you're using one system like Epic or you're using 7 different systems, that's okay, as long as that data is following standards and can interoperate both ways to make sure that the right person at the right time has all of the appropriate information for diagnosis as well as for treatment. The second thing is ontology is important. We need to make sure that when we are interoperating with all of this data, we know that we are talking about the same thing and the right thing. We can use the best AI and ML models out there, but if we don't have that ontology, the outcomes are not going to be as we would expect. And then finally, actionable decision support. So integrating clinical trials, integrating treatment suggestions, and making sure that the provider, the diagnostician, and the patient have everything at the end of the day to make sure that they are making the right decision. And at the end of the day, it all comes back to the patient, such as my friend's father, who we had just talked about, and really making sure that we finally get to the point where we can axe the facts, axe that PDF, or even axe that patient portal that was mentioned earlier today so that we can have all of that data at our fingertips to provide the best care for patients. Thanks.